It's the 19th of June, exactly 113 years ago. The first Father's Day was marked. But today is also World Sickle Cell Day. And we're going to have conversations on that. With me in the studio is Kweku Kwating Yeboah. It's a young man living with the sickle cell condition. Sitting next to him is Mrs. Charlotte Owusu, who is the president of the Sickle. Miss Charlotte Owusu, president of the Sickle Cell Condition Advocates, and Dr. Eugene Tete, who is a specialist hematologist at Kolebu Teaching Hospital. He loves blood. That's his job. Boss, how are you?
Fine, thank you, sir.
Can I assume that sickle cell condition is a blood condition?
Yes, it's a blood disorder.
Okay.
Yes, so it's a condition in which the red cells, the hemoglobin in the red cells is of what we call is structurally abnormal. So I keep stressing the word structurally abnormal. Mm-hmm. It doesn't mean that it is bad, but the structure is different from what many people would know, the hemoglobin A. And it's when you have two abnormal hemoglobins and one is at S, then we say you have sickle cell disease. Yes.
Yeah, all right. Kweku, what's it like living with sickle cell disease?
It's pain every day. It's difficult. It's difficult. You have something bothering you every day in your legs, in your joints, in your arm. Every time there's something there, hurting, just hurting. And then after some time, you are like, let me forget about it and go on. But it's very difficult. It's very difficult. I ask that people test. Our group has been talking about people testing before they get married. Our focus is to not let you give birth to children who would suffer as much as I have. It has been difficult living with it. While young, you don't get to do sports. While in your teens, everybody is doing everything. You can't do it. It's 6, you're cold. You can't do cold water. There are several things you cannot do. Just cannot do. So eventually you are like, it's difficult.
Frustrating?
a whole lot. You know, everybody does football. You are on the sidelines every time. You don't do basketball. So eventually you see them doing it, you think you can do it, you do it 5 minutes and then you're tired. You do it 10 minutes, you are overwhelmed. Can't do everything everybody can do simply. Things people do and they're like, oh, they'll do this and then they'll do this. You are like, oh, let me take it in portions. And so you eventually, it's difficult.
Thanks for sharing. Charlotte, what are some of the biggest challenges you face when it comes to raising awareness about sickle cell disease?
The difficult thing is that people don't understand that it's something normal. It's with us as black people, black-skinned people, but the whites don't have it. And so it's something we should understand that it's within our community, our system, as a part of us as black people. So when you talk like he's saying, he's my son. But sometimes I don't even understand why it's always like that. So even 3 days ago, I tried to get a lady from UK who has sickle cell. Is it every day? Because this gentleman always complain almost every day. Sometimes he keeps quiet, he will shut up, shut down, wouldn't even talk. So people should understand that it's something which is breaking down the system in a way. And these people too, fortunately, one good thing about them, which God has done for us, is that they are very intelligent, very smart. If maybe you have to tell what he is doing. The way they are able to, they have the brains to do everything. Anything they want to do, they can do it. But this problem of getting sick often posed down. So we want the people to understand, and that is what we are championing. They should understand that sickle cell is not contagious, and because of that, you are not looking at it as we look at other diseases which are contagious, like when COVID came. We were all not involved because you don't want to have it. But this one is only the person suffering. We are within the house, and he's alone suffering. If he had other siblings, they wouldn't even understand why so much attention should be given to him. But people should understand. The family setting should understand. Your immediate family should understand. And when they understand, they'll give you the support you need. You know, that's what I had. I was fortunate I had a family who were very supportive for me to take care of them. They were two. So if they understand, they will support you. If you are in the school and the school authorities are told, they will support you. If you go to the hospital, the doctors should know. Unfortunately, some of them in some places, private, and they don't know. So they would even ask the patient, when this thing happened, what is given to you? Can you believe it? We have a set walk-in center where people come in anytime with their problems. There was a day a young man, his national service man, came and just said, "Ma'am, you have to do something about our situation." I was sick, screaming on a bed, and the doctor just said, "Oh, these people, they are just like that, excuse me." Anyway, but nobody can feel their pain to know exactly what is happening to them. So we have to do something for them to understand. Then the government is the ultimate. The government should make sure that we understand, so that we see the need for prevention. Because with all diseases, we prevent it, isn't it? Even malaria, everybody tries to prevent make sure he's not getting malaria.
So understanding on all levels, and then support.
And support. Yes, you should get the support, understand the system. Even with them, they should even understand.
Yeah.
So that they will know that this is your situation. Nothing, so that they can respond to whatever support they are having.
Thank you. Thank you so much. Let me come to Dr. Tete now. So what are some of the misconceptions about sickle cell disease? Is it only a black person's disease? And are there any recent breakthroughs or promising treatments on the horizon that can lessen the pain of people like Kweku?
Yeah, so the misconceptions are many, and Auntie Charlotte will talk about a lot of them. But the first thing is, I mean, as he said, people don't understand what they go through. I always give, I don't know whether any of you have remember, there are people who always have bandages on their legs. When you go to some of our villages, they have chronic ulcers, and the assumption or the myth or whatever it is that they are witches who use their legs as chopping boards. And these are sickle cell patients.
Wow.
All right, yes, they have chronic leg ulcers. They live with some of these things. People, even in schools, you know, we are saying that they are living with a condition. So we say people living with sickle cell disease, they are not sicklers. We used to tell them they are sicklers.
Yes, sickler.
You are a sickler, yes.
And immediately you think, this someone is always sick.
Yes.
You didn't even know it was linked to the word sickle.
They are living with a condition. Yeah. So there are a lot of misconceptions at workplaces. Even there are some places where people don't want people to know that they are living with a condition because they are treated differently. They sort of not isolated, but you feel that everybody's looking at you with a different eye, and all these things are part of the problems that they face. For treatments and things, there are a lot of things we have now. I mean, hydroxyurea is around, and it helps to reduce the number of crises, the frequency of crisis, the severity of crisis, severity of transfusions, and others. There are others. Crizanlizumab. There's currently a trial going on in Kolebu.
Oh, okay.
Yes, there's a big trial going on in Kolebu, and we are giving some of them. We hope that some of these things will help make their condition better. Okay. But the main problem, I mean, as Anshalo said, is people understanding. People understanding, and he mentioned that some doctors don't even know what to give them. I mean, it's true. I've had conditions where I've given patients medications, and other healthcare workers have told them, don't take it. Yes, when they are in pain.
Well, you are the
yes. So they go to other places and say, well, don't take it. This one, this one is too strong for you. This one is for cancer patients. This one is this. Yes. When you want to alleviate pain. So it's quite difficult. And these are healthcare workers telling the patients some of these things. So it's difficult. The doctors themselves need to understand. The healthcare system, nurses, pharmacists, everybody involved, physiotherapists, we all need to understand. The patients, the family, community needs to understand. The patients themselves need to understand that I say they are unique, right? They are very unique. They have they have their own strengths, and I've met some very smart sickle cell patients, very, very amazing in terms of what they can do. But they need to understand that they have certain things they have to keep away from so that they can live a normal life. Yes. So it's a difficult situation, but we are doing our best to see how we'll give them a semblance of a normal life, something like that. Yes.
All right, let me come to Kweku now. Yeah. So Kweku, can you share like a success story or personal achievement that you have achieved in spite of living with sickle cell? So, mommy was saying things and you're looking shy and say, don't talk. But maybe there's some great things that mommy wants us to know about you, man. So talk to us.
Mother would always say big things about your child. Yes. Your child. But we have done a lot with one of the things I'm most grateful about is my recovery from stroke 3 years ago. 3 years ago, I woke up from bed and I couldn't stand. I woke up 3 times and I fell to the ground. Yes. And so on my left, I was fully paralyzed. And I was shocked, like, what is happening? Now I'm rushed to Port Clinic, and then Dr. I of Port Clinic and looked in my eye and says, Kweku, I think you are getting a stroke. And I'm like, what will we do about it, boss? Let's do something about it. And then he rushes me to Kolebu, and Kolebu, there was no bed syndrome. And I'm like, will I get a bed when I get there? And God being good, I get a bed. A specialist comes to look at me, and they help me through it. And in 3 years, you'd see me and you wouldn't believe I was going away. Wow. That's why I'm thankful for what I've been able to do. Over the last 16 years, I've run a program called the Ghana Higher Education Fair. Literally gone around all the regions telling our youth that they should do higher education. Several things I have done. I've actually risked a lot, but I think we'll be here for just a short time, so we should make our mark in the sands of time.
Awesome. Congratulations.
Thank you.
We're proud of you, man.
Thank you.
Nice. Mommy's smiling and thinking about the challenges he has overcome. Yeah, well done. So, Charlotte, what are some of the lesser known ways that people can contribute to the cause of creating awareness about sickle cell death? It is beyond financial. How can we support beyond financial contributions?
We first of all, when we realized that our children, they were 2. I lost one at the age of 17. That's the first one. As soon as they don't know, they were actually the first and the second. I realized that something should be done to help them. As I said, I have the support, all right. The government, as we see, the health system should know well educated to know what to do for them. So we started with family. I put some parents together to form a
support group.
Yes, so that the women were just being. When I went to Kolebu with them, we were living very close to at Mamprobi, Dansuma down to Mamprobi, so we could go in and out of Kolebu often. And women come, they are so frustrated, they don't know what to do. So I wanted to learn and know how to encourage them. So I was encouraging them a lot to live on, let's see what happens. So when I went to live in Pema, we formed a group of parents and patients, trying to give them that support. So first of all, the patient needs support from all of us to live with the doctors. Some of them are doing very well. Dr. Tete, we've known him for some time. They are doing very well to support them to live. Like he went through this stroke. It was Kolebu staff who saved him. Within 6 days, we're out of hospital. You wouldn't believe it. So this support is there, but we need, since what they are going through is so challenging, and so it takes a lot of money. Talking about this what do you call it?
Hydroxyurea.
It's you know, now it came in as a free thing for them to enjoy, you know, and it's helping them. In fact, they have confessed. Yeah, I go around a lot to the hospitals with patients, and because our office is open, it's the walk-ins, and everybody comes in and talk and say something about sickle. No, what are you people doing about our situation? What is happening? What happened? So we try to get them to understand that what we can do is, first of all, to get the medical people well grounded to be able to look after these people. So in Tema, we had a training program for doctors and nurses to establish the General Hospital Sickle Cell Center. We have a Sickle Cell Center there. We as a parent, when we were there, but later I went to, we formed the National Association, and I was the organizing secretary, and we did well to get clinics in, sickle cell clinics in all the regional hospitals, most of them, yes, except two which they have started, but we have to officially go and see how they are managing. You get me? So to help them, this is how to help those who have the condition. So what is the way forward? We should prevent, and the prevention, when as soon as I realized my children has sickle, I said, what is the way? How can we prevent it? Because we could have, if we knew, we wouldn't have come together. And the only thing is 75% of us, the black people who are AA, they are AA, and meaning they don't have sickle cell in them. And about the 25% among we, 2% are the sickle cell. Well, don't think it's 2%, it's only you. It affects the whole family. The whole family's life, you know, going about their normal life.
Example. Your family is an example.
Yes.
Yeah.
It affects everybody.
It's not just the person who is living with it.
Yes.
Right.
So if it is affecting everybody, then what do we do? The way forward is to prevent. And I said, what is the prevention? Since this 2% and the 23% who are AA or ACS, doctor is saying he's ACM AS. We are the people who carry the AS and the ACs. We are the healthy carriers of this disease. We are very strong. And we give this disease to them. So why don't we go to the AA? Those who are don't have it at all. They can march all right, and then we can have people who will come into the world without this disease.
I'm glad that you have kind of moved into this side of the conversation, because I want to bring in Dr. Tete now, who is wearing a t-shirt. I am AC. I mean, AC could be air conditioner, but this is not air conditioner.
Yeah.
You need to explain what this is and how this is linked to genetic counseling and how important it is for individuals and families as far as dealing with sickle cell condition.
So that's where Aunt Charlotte is coming, the prevention. So yes. I'm AC, so it means that my hemoglobin type, the majority is hemoglobin A and C. Mm-hmm. So as Aunt Charlotte said, 25% of our population are carriers. That's about 1/4. Mm-hmm. And then 2%, approximately 2% of our babies have sickle cell disease. Now I'm AC. If I should marry somebody who is AS, then my C and the S from my partner can get SC, which is a sickle cell condition. And that's what Aunt Charlotte is saying, that we should prevent it. So I know I'm AC, so I go to AA. So I don't go towards anybody who will give me any sickle cell.
So does it come up in your conversations as you are chatting with the chick?
Oh yes. So that's what we need to do. So we need to get everybody involved in the primary school, in the junior high school, secondary schools, in our churches, in our communities. We should, if you know, then you can talk about it. So you don't even get to get near anybody whose combination will give you such a problem. And that's where that's the prevention.
All right.
So it starts with getting to know yourself.
Awesome.
So once you know, then everybody, Aunt Charlotte is AS. So it means that if Aunt Charlotte were to be of my age, I will not go near her.
Even if you like that, you wouldn't go.
You wouldn't go near her because
Don't go there.
the probability is there.
It's there.
And then it is not you who will suffer, but the offsprings.
Yeah.
And that's the problem. And this is what other people have done very well in their countries. And that's what we are trying to get our people to understand.
Okay.
Know your state, know your condition, know your status, and then you can decide what to do next.
Two quick things I want to try before I come to a quick one. Does it get more severe with age?
It is, the condition itself does not change, but just like with age brings its own players. Increasing age as you grow, certain things also change in your body. Okay. So then it changes alongside.
All right.
Yeah, but the disease is the condition is the same in babies. Okay. As you grow, adults, middle age, everybody. Right. But when you get other comorbidities, assuming you get kidney failure and you have sickle cell, but sickle cell itself can affect the kidney, so it becomes a double hit, and that becomes a problem. Yeah. Right. And the other things, when you get osteoarthritis, you already have pain, and then you get osteoarthritis, you get a stroke, and then other things come into play. Yeah.
Okay. Quick, briefly before we run out, what advice would you give to someone who is newly diagnosed with sickle cell disease, knowing what you know?
Oh, I would ask them to not panic and mostly use water. Water is the best therapy. The more you drink, the more fluid your blood becomes. So it's blocking your joints is there's a low probability it will block your joints and give you the pain. And so for anybody who has sickle cell, I'll say water. Most of the time we see that if you have a crisis, you go into the hospital, the first thing they'll do is put on you an IV fluid so that it mixes your blood and let it flow. And so if you already know that when you go down they'll give you water, then just
start drinking the water.
Start drinking the water.
That's what
I met, like my mom was saying, I met a girl who came to our office and she was like, oh, now I'm doing 4 liters a day. I'm like, great. And then she asked me how much I'm doing, and I said I'm doing 8 liters. She said, hey, that's too much water.
You but drink water, yeah?
Yeah, drink a whole lot of water.
Today's World Sickle Cell Day. Anything that you're celebrating today that we must be aware of, or how do we get in touch with your organization?
Yes.
Quickly.
Since today, by God's grace, we have been given the green light to talk openly about prevention for people to know. So we are going to, fortunately, we've been sponsored by Alisa Hotel in Tema to come and screen their staff for sickle. So we first give them a presentation, and then we screen them, and then we launch the prevention of sickle cell.
Awesome. What time?
2 o'clock.
2 o'clock.
So we expect GBC to be there.
Inshallah. Dr. Tete, I'll leave you with the last word.
So for me, the message is the same. Get to know your status. So I'm AC, and I'm wearing this throughout the whole day. And if you come to Kolebu, I'm sure most of my colleagues will be in there, AA, AS, whatever. Just wear it, and as people see, they'll ask you, and then you tell them, just get to know. And let me add that, on my way here, I called my laboratory in Kolebu and I asked them, the cost of electrophoresis, what that will tell you your AC or AS, is 65 cedis. Okay. 65 cedis. And I tell people that 65 cedis to prevent the kind of things we know, I think it's a very good, it's an excellent bag.
65 cedis. Know your status, AC, AS, whatever you should know. Dr. Eugene Tete is a specialist hematologist at Kolebu Teaching Hospital. He deals with blood issues. Next to him is Ms. Charlotte Olusu, who is president of the Sickle Cell Condition Advocates, and NGO raising awareness and funds about this condition. And Kweku Kwating Yeboah, who is a young man living with the sickle cell disease. Gentlemen and lady, happy World Sickle Cell Day to you. All the best with the Alisa action. And Eugene, keep doing your good job. Congratulations.
Thank you.
Keep fighting. Nice one. My name is Kafri Day. How you day, Charlie? Sports they come up, and there's a bad man who beat a referee, a woman referee. Shame on that guy. Montiti is going to expose him on the sports news. All right, stick around. Don't go anywhere. Shame on you. Shame.